Good morning. I don't know how many of you are aware of orthoptek, but it is a simple instrument which is based on the fact that when M cells and P cells are sequentially stimulated, it leads to stimulation of occipital cortex, frontal cortex, and parietal cortex. The vision is not a function of just occipital cortex. Occipital cortex is what I call it as Manmohan Singh of the brain. It doesn't do anything to the visual impulses, it just forwards it to the high command. The high command being the parietal cortex and frontal cortex, which analyze the impulses sent to them and send back the information to the occipital cortex. While sending back the information to the occipital cortex, from the parietal and frontal cortex, there come what is called as the top-down impulses. These top-down impulses are recognized in the EEG as alpha and beta oscillations, and the impulses going from occipital cortex to inferotemporal cortex is recognized as gamma impulses. So the top-down impulses fast forward the impulses at the occipital cortex and thereby improve the vision in a rapid manner in amblyopia and also improve the motor control in a number of cases. That's why it's important in treating not just amblyopia but also important in treating sixth nerve palsy and in fourth nerve palsy. So I will not go into the details. It's just to know that it's very easy to set up the machine. Even a child aged 4 years can use the machine, and it's very useful in treatment in reversing some of the squints, particularly the intermittent divergent squint, and reduces the amount of esotropia, and also exotropia is completely nullified with this instrument. It's easily available. There are many indications, as I told you earlier, amblyopia of all types, and particularly the anisometropic amblyopia, and it's also useful in fourth and sixth nerve palsies, in dissociated vertical deviation and recurrence of XT after surgery, and in nystagmus and some cases of optic atrophy. Some of my people who have bought the machine, they have told me it is useful in optic atrophy. There's a very complicated mechanism. I can explain it to you outside. And post-squint surgery, where the movement limitation is not due to muscle slippage but due to other causes, it responds very well. If it is due to muscle slippage, you have to operate. So it's useful for general ophthalmologists and strabismologists equally. Financially viable because many ophthalmologists have recovered the initial investment within 6 weeks of buying the instrument. And the following video shows how to set it up. It's very simple. Fix it on a wall, and how to use it is like this. And the child is given a laser pointer which he points out, and it improves the hand-eye coordination. The hand-eye coordination improves because the hand area in the brain is situated very close to the frontal eye field area. So when the eye moves, the hand is stimulated. When the hand moves, the eye is stimulated, and the top-down effects will be on the foveal area in the brain. You can see a child aged 4 years give chips in one hand, and you can see that holding the chips. I said you do it for 10 minutes, you can eat 2 chips, and the child does it, and adults can. This is the response of some of the users. They said it's a wonderful gadget, and I have never experienced the results like this in the past. And to know why it works, it's the most complicated, and this figure explains to you why it works. The P cells and M cells, although they are contiguous in the retina, they are not together in the brain. In the brain, they go to different parts of the brain, and they are analyzed for different reasons. The P cells analyze the color, shape, size, structure, and surface of the object. The M cells analyze the motion and the spatial location of the object. And these two are connected to each other, and we make use of this connection in the brain between M cells and P cells, leading to repeated use of M cells, which stimulates the P cells, and the P cell stimulation removes the obstacle which is at the 4C beta in the brain. In the V1, the obstruction is at the level of 4C beta, whereas the M cells go to 4C alpha. So stimulation of M cell 4C alpha leads to stimulation of parietal cortex. The stimulation of parietal cortex in turn leads to stimulation of occipital cortex, and this is an alternative pathway we make use of in stimulation of amblyopia. And that should, I am the inventor, I have financial interest. Thank you very much.